Good day. I'm going to talk about APGAR scoring and Ballard's assessment. What is the purpose of the APGAR scoring? Its purpose is was designated to help healthcare providers assess a newborn's overall physical condition so that they could quickly determine whether the baby needed immediate medical care. And for the purpose of the Ballard's assessment is to evaluate a baby's appearance, skin texture, motor function, and reflexes. Moving on, the neonatal history. Patient Z, age of gestation 38 weeks, date and time of delivery September 7, 2019 at 7:30. Amniotic fluid clear, presentation is cephalic, type of delivery is NSVD. His vital signs are temperature is 36.3 Celsius, pulse rate 153 beats per minute, respiratory rate 60 cpm, weight 33.5 kilograms, height 54 cm, head circumference 34 cm, chest circumference 32 cm, abdominal circumference 30 cm, mid-arm circumference is 13 cm. As for the diagnosis, a live baby boy 3.5 kilograms term 38 weeks AOG, cephalic delivery via NSVD, and the complications of the baby is none. For the APGAR scoring, this is the APGAR scoring of the baby. For the first minute of life, the infant's body looks pink but the extremities appear bluish. HR is 120 bpm, RR is 60 cpm, has weak and irregular cry after, and then for 5 minutes after the skin appears pinkish all over the body. HR is 123 bpm, RR 63 cpm, still the same facial grimace when stimulated, well flexed arms and legs, and good strong cry. Poor sucking and swallowing noted. And for the weight, it is 3.5 kilograms. Here we will look at table 18.2 and then score the baby's assessment. For the appearance, as we can see, the appearance of the baby looks pink. You will see that sa in table 8.2, which I put a score of 1, and then after 5 minutes I put a score of 2. Then the pulse, I put a score of 2, and then after 5 minutes it was still the same, so I put a score of 2. And for the grimace, it didn't change, so after 1 minute it is 1, after 5 minutes 1, activity still is the same. For 1 minute I scored 2, then after 5 minutes I scored 2. Then for the respiratory, um for 1 minute I scored 1, and then after 5 minutes I put 2. So I add all of it the 1 minute after birth. So as you can see, 1 plus 2 plus 1 plus 2 plus 1 is 7, and for this is 9. And for the nursing intervention is that the baby is in good health and will only need routine post-delivery care. And for the after 5 minutes, the baby is in good health and will only need routine post-delivery care. For the Ballard scoring, physical maturity is skin is crackling, pain with rare veins, lanugo found in bald areas, plantar creases anterior to 2/3, breast with areola raised 3 to 4 mm bud, ear form 7, firm with instant recoil, testes with good rogue. And for the neuromuscular maturity, full flexion of arms and legs, 30-degree angle square window angle between hypothenar eminence and anterior aspect of forearm, arm recoil less than 90 degree when forearm is flexed for 5 seconds then released, 90-degree popliteal angle.